It was October 11, 2001, 1 month after 9/11, and the day anthrax hit the news. It was also the opening day for the 36th Annual American Dance Therapy Association Conference in Raleigh, North Carolina. I was one of the co-chairs, and we had spent about 2 years planning for the conference. Right after 9/11, we weren't even sure that we would have a conference. Fortunately, we were able to proceed with the conference. However, many New York members and presenters were unable to attend due to the recent tragedy. There were many holes and slots available in the program as people realized they wouldn't be able to make it to North Carolina. At the last minute, I offered to do a physical storytelling workshop to fill one of those slots. 20 dance therapists attended that workshop. Physical storytelling is a form that I learned from dance movement therapists Connor Kelly and Steve Harvey. A teller shares a story in a group setting, and then the teller chooses members from the audience to retell that story in movement. The teller then becomes part of the audience to watch their story unfold. Physical storytelling has aspects of playback theater, authentic movement, and dance movement therapy. When the mover shares in a group setting, it validates their stories and the emotional response to it. The mover's retelling of the nonverbal story adds the collective unconscious and their listening perspective of the story that may be new. The teller has told the story many times in their head over and over with the same ending. The movers stepping into their role have a huge empathic connection because they actually step into the story. The teller actually has a chance to step out of their own story so they can hear it with new lenses, have new conclusions, perspectives, and understandings. The viewing audience responds to the movement retelling by projecting their response onto the story as well, sort of like a moving Rorschach. The story that needed to be told that day was of a dance therapist that worked in a Brooklyn hospital. The day room of the hospital looked out onto Manhattan, where they could watch the towers burn and fall. The dance therapist had a brand new student there. There were patients in the day room, and she was there watching the horror. Her question for us and dilemma in the workshop was who she was supposed to be, what she was supposed to do, and what it all meant. Was she there to be a supervisor, a therapist, or a citizen? As facilitator of the workshop, I was also director, and in the North Carolina conference room, there was a huge window that looked out on downtown Raleigh, so that became the stage. The teller chose 3 movers. They agreed to play her as therapist, the student, and the patient. I had the 3 movers turn and face the window looking out into the city, while the teller and myself as director, as well as the rest of the audience, sat in the back watching the story be told from the back using the movements. As the story began, they began far apart from each other. As the story unfolded, they began to move closer and closer to each other until at the end they were holding each other with that shared experience of looking out the window at the towers burn and fall. The group had a validating and empathic response to the widest range of feelings and experiences. There was a sense of cohesion in the group and a sense of validation for the teller.